Hi guys! As you may know, I have stage 5 chronic kidney failure, and today I thought I would talk about what chronic kidney disease is, what causes it, what the typical symptoms are, and treatments. The kidneys are two organs located in your midsection on either side of your spine in the middle of your back, just above the waist. They get rid of excess water and toxins by producing urine. They filter your blood up to 30 times a day. In addition, they regulate blood pressure, make red blood cells, keep the components of your blood in balance, and help keep your bones strong and healthy by activating vitamin D. Chronic kidney disease is a long-term condition where there is a progressive loss in kidney function over a period of months or years until the kidneys do not work anymore. It is usually identified by a blood test for a chemical substance called creatine, which is basically a breakdown product of the metabolism in the muscles. Higher levels of creatinine indicate a lower kidney function, or glomerular filtration rate, GFR for short, and as a result a decreased capability of the kidneys to excrete waste products. Chronic kidney disease is usually classified in 5 stages as shown in the table. It is very common, affecting over 3 million people in the UK alone. However, it can go undetected as many people have no symptoms until stage 4 or 5. The symptoms of chronic kidney disease can vary from person to person. These include nausea, vomiting, fatigue, weakness, shortness of breath, insomnia, muscle cramps, increased urination and headaches. For me, I've had most of these symptoms, but the worst one is feeling exhausted all the time. It's really hard to describe how tired and exhausted I feel. But it's like living with an intense, deep exhaustion that makes every movement feel like I'm walking at the bottom of the ocean with a huge 10-ton weight on top of me. And it doesn't matter how much sleep I get, 3 hours or 10, I feel the same. Kidney disease is usually caused by other conditions that put a strain on the kidneys. Often, it's the result of a combination of different problems. There are many causes, some of which are shown here. There are 2 main treatments for chronic kidney failure: dialysis or transplant. Dialysis is the procedure to remove waste products and excess fluid from the blood. There are 2 main types: hemodialysis, which involves diverting blood into an external machine where it's filtered before being returned to the body. Then there's peritoneal dialysis. This involves pumping dialysis fluid into the space between your tummy to draw out waste products from the blood passing through vessels lining inside your tummy. However, although dialysis keeps you alive, it still leaves you at the mercy of the many and varied complications brought about because dialysis just cannot do the same job as a kidney. A kidney transplant is a transfer of a kidney from one person into the body of another. It can either come from a live donor or a dead donor. Before you're placed on the transplant list, you have to have a number of tests to see if you're fit enough. If you're getting a kidney from a live donor, they also have to have a number of tests as well. But the operation is planned months in advance. If you're waiting for a deceased donor kidney, the transplant centre will contact you when a suitable kidney comes available. This can take any time from 1, 5 to 10 years and can happen at any time of the day or night. The new kidney is placed in the lower part of your tummy and connected to your blood vessels and bladder. Your own kidneys are usually kept in place. A kidney transplant is a major operation with a wide range of potential risks. In the short term, these include blood clots and infection. Then there's the problem of rejection. On top of this is the concoction of immunosuppressant drugs that you have to take, which in turn lowers the immune system so that puts you at the risk of numerous infections. Then there's the increased risk of cancer and diabetes from taking all these drugs. And then there's the underlying disease that caused the kidney failure in the first place, which is still there. So even with a new kidney, you still have a whole new set of problems to deal with. Some problems may affect people more than others, and some people might have no problems at all after a transplant. Around 6,000 people are waiting for a kidney, with less than 3,000 transplants taking place every year. There is no magic cure for kidney failure, just different ways of living or coping with it. But that may change as advances in medicine are being made every day. In my next video, I want to talk about how kidney failure has affected my life and my transplant journey so far. Thanks for watching, and please don't forget to click the like or subscribe button. See ya!